In the wake of the second wave of COVID-19, Uganda's health sector, just like elsewhere, was still nursing bruises of the harsh effects of the first wave of the pandemic. In less than a month, available reports show that the health sector continues to suffocate on surging numbers of patients, giving way for increased inadequacies in key medical supplies like ICU services. This wave has also exposed scarcity in access to medical oxygen in most health centers countrywide, with patients said to part with fortunes to catch a glimpse of the life-saving resource.
We see that private health facilities and companies are more preoccupied with profit margins, and that is really getting families into catastrophic health expenditures, as we can all see. And some of us could have had family members that have gone through that.
In anticipation of a worse scenario, civil society organizations want government to increase production and supply of oxygen for all those in need.
We would like to see protection of patients and families by regulating costs of oxygen therapy, related tools and equipment that are going out of hand and the population being exploited.
Also calling upon government to waive completely all oxygen tariffs, so that whoever can provide oxygen can bring it in free of charge, so that we save lives.
In their view, government should initiate a public-private partnership with local manufacturers to boost production that will in return increase accessibility and affordability.
I've also learned that the Army has started providing oxygen. How much is the Army providing? And how soon can it concentrate the whole country of this oxygen so that we stop losing people? Can government provide a supplementary grant and grant to the organizations or the manufacturers who have been developing or making medical oxygen?
Meanwhile, the Executive Director, Action Group for Health, Human Rights and HIV/AIDS, AGA, Flavia Chomkama, appeals to the State House Anti-Corruption Unit head, Colonel Nakalema, to weigh in and protect Ugandans against what she terms the high cost of health services in private facilities.
Nakalema, she went to the tax park and made sure the government offered buses to take people back home at a subsidized cost. Can Afande Nakalema go to the hospitals or try to regulate the amount of money we are paying in these hospitals? It's as if you are leaving us at the mercy of business sciences for health, people who have started hospitals.
Recently, government pledged to enact the National Scale-Up of Medical Oxygen Implementation Plan of 2018-2022 to address availability, accessibility, and quality of oxygen therapy. Dorcas Kimono, UBC News.